Hi, everyone. Thanks for joining us. We're going to give about 30 seconds for folks to join, and then we'll do introductions and get started. Well, welcome everyone. Thank you so much for joining us tonight. I know it's can be a challenging time of evening for families, but we're really happy that you've joined us to talk about the pediatric COVID-19 vaccine, which is now available for 5 to 11-year-olds in Vermont. And I'm Becca Bell. I'm a pediatric ICU doctor at the University of Vermont Children's Hospital in Burlington, and I'm the current president of the Vermont chapter of the American Academy of Pediatrics. And I'm so happy to have Dr. Ashley Miller with us tonight. Dr. Ashley is from South Royalton Pediatrics, and she is going to talk to us tonight about the COVID-19 vaccine in children. And just to let everyone know, the way this works is Dr. Ashley will give a presentation that will be about 20 or 30 minutes. You're welcome at any point to put some questions into the Q&A. Only we can see them, so they're completely anonymous, so ask away. And then we'll spend the second half of the hour answering all your questions. So thanks again.
Great, thanks, Becca. So welcome everybody. Hopefully this will be informative for you. And as Becca said, please go ahead and write any questions into the Q&A so we can answer all your pressing concerns. I just wanted to start tonight by talking a little bit about COVID-19 in Vermont and in our 5 to 11 age group. Appears that I am not able to forward my slides. There we go. So one of the big things that I've heard from a lot of parents is just, what are the risks of COVID-19 in this age group? Like, aren't these young, healthy kids? Aren't they doing fine? You know, I'm not hearing a lot of, problems. So what we're looking at is the national data right now is over 8,000 hospitalizations. So to me, that's not, no big deal. That's a lot of hospitalizations in these kiddos. And approximately a third of those hospitalizations actually require ICU admission. So they have pretty severe disease. When we look at COVID deaths by age group, you can see in the bracketed area, that's the group we're talking about, the 5 to 11s. There's been 94 deaths, which is 1.7% of all deaths in children 5 to 11. So that's a pretty significant number as well. And, one death is one death too many. So when we look at our Vermont cases, this is as of November 13th, and you're probably seeing this in your communities. The cases are definitely rising again. We all kind of wish we were back in summer when they were nice and flat. But as you see at the edge of the graph, the purple line is the 6 to 11-year-old children. So that's up quite high now compared to our older kids, which are the green line, and the middle line, the blue line, is our younger kids under age 5. So things that can happen when people get COVID, we're seeing pediatric COVID pneumonia. So that's a disease of the lungs. And what happens there is the lungs aren't able to transmit oxygen into our bodies. So children are needing to be hospitalized for oxygen supplementation. And in the more severe cases, they actually need to be intubated, and a machine needs to help them breathe and help them oxygenate their blood. So there's been some severe cases among our adolescents. And when we're looking at the vaccination rates, the higher they are, so like Vermont, we've been really lucky with our adolescents, the more protective it is. So with cases rising due to the Delta variant, it's really important that we continue to think about those protective measures. And we know nationally that unvaccinated adolescents are actually 10 times more likely to be hospitalized due to COVID than vaccinated adolescents. We're expecting to see similar things in our 5 to 11 group. So one of the other things you may have heard of as a complication is this multi-system inflammatory syndrome, also known as MIS-C. And when we are looking at this, we see inflammation in the body, and we can see that on blood work. This has severe illness, so it's not just runny nose, cough. It's actually severe illness requiring hospitalization. And then we say that 2 or more organ systems are involved. So we're talking like heart and lungs. And the heart is the myocarditis that you may have been hearing about, which is the heart muscle inflammation. And they have to have had recent or current COVID infection. And so far, we've seen over 5,000 of those in the US, and we've actually had 48 deaths related to MIS-C. And this is another graph just showing you an age group. And you can see that 5 to 11 group that we're talking about now for vaccines is actually the most affected by MIS-C. So common questions we're hearing from families: does my child need to get vaccinated? What are we protecting them from? I think we went through a little bit of what we're protecting them from, but also what are the risks of vaccination? So just to understand how COVID vaccines work, they're very similar to all other vaccines that your children receive. So we introduce something representative of the virus to the body. And the idea is then our immune system can rev up and be ready to protect us by making things called antibodies. So when SARS-CoV, the virus that causes COVID, is introduced to our body for whatever reason, our antibodies can fight them off. So you have less of a chance of getting COVID. And if you do get COVID, you're likely not to be as sick as you would have been if you had gotten it without the vaccine. So the other question we ask is, how effective are these vaccines? We're actually really, really lucky. These vaccines are highly effective at stopping people from getting COVID, and they also prevent serious illness, hospitalization, and death. We don't know yet how long the immunity is going to continue to protect people, and that's something we'll learn as we continue to move on. But right now we know that the vaccine is very, very effective. So the other question is, how do we know that they're safe? So far we've been seeing, millions of adults vaccinated, doing well. The youth that are 12 and up have done great. And then we've done those important studies like we do for all vaccines for those kids 5 to 11. So we've already seen where they give saline to one group and the vaccine to the other, that the vaccines have been very safe. And what we had was the CDC and the FDA monitoring these things and helping us make decisions about the safety of the vaccine based on all the data they've already collected, which is wonderful. And an interesting fact is we actually have had the most intensive safety monitoring for any vaccine in US history with the COVID vaccine, which is really pretty awesome. So when we look at percentage of kids who 12 to 17 have gotten the COVID vaccine, you can see Vermont's doing awesome at 81%. And we're really hopeful that our 5 to 11 group will also reach that number. So the timeline for this, as you may remember, that in December of 2020, that's when they did an emergency use authorization for 16 and older. So we're approaching a year, which is incredible. In May, this EUA was extended to include the 12 to 15-year-olds. And the CDC, again, recommended that they should be vaccinated. In August, we got the full FDA approval for 16 and older, so they completed all of their safety studies. They're continuing to monitor its use, but it has full approval now. And just recently this month in November, we had the EUA come through for the 5 to 11-year-olds, which is the pediatric dose. And again, the CDC recommended for it to be given. So these are, really exciting. Seems to be a short period of time, but there's been a lot of work behind the scenes, a lot of people volunteering to be part of the studies, which has allowed this to move through so quickly. And then the manufacturing occurred right with the beginning. They didn't wait for it to be authorized, which has allowed us to get more shots in arms and protect people. So in the US, over 100 million people have been fully vaccinated, which means at least 2 doses with the Pfizer vaccine. 12.6 million youth ages 12 to 17 has also been fully vaccinated. And as of the 17th, 2 million children ages 5 to 11 had already received a dose of the pediatric vaccine. So you can see we have a lot of experience with all of these people, both adults and younger people getting the vaccine. The big difference in the 5 to 11 group is that it's a smaller dose of the Pfizer vaccine. So same manufacturing ideas, same science behind it, but just a smaller dose. And the beauty of this is that small dose in the younger kids actually creates the same immune response that the bigger dose did in the 16 to 25-year-olds. It also creates the same efficacy, that 90% efficacy, which is incredible. And differently, this data was actually collected during the Delta wave, and we're still seeing a 90% efficacy. So some people were worried that the numbers we had for the older dose of COVID wasn't accurate because Delta was a new strand, but this data was collected during Delta. So we're still seeing a good efficacy, which is great. And then in all of the studies, there were no serious adverse events related to the vaccine. This is just another overview of how they do those studies. So some of you may have already heard of the different phases. So phase 1, 2, 3. We talked a little bit of how they randomize. So some people get placebo, some people get the actual vaccine. And in the first phase, they actually look at dose finding. So they have the age group that we're interested in, and they gave them different doses, so 10, 20, and 30, to see how they compared in efficacy and immunogenicity. So then when they moved into phase 2, 3, they had already picked the final dose of that 10 because it was, as we talked about, shown to be as effective, which is great. So when we're in 2, 3, they had that randomized that we talked about. So the dose 1 and dose 2 were either saline or the actual vaccine. They looked at how that worked again for the immunogenicity. They looked again at efficacy, and then they also looked at the safety of the vaccine. So people want to know, what about side effects? What am I going to expect? Some adults who had gotten the Moderna vaccine or even the Pfizer vaccine felt like they had pretty significant side effects. They didn't feel well for a little bit. They don't want their kids to go through that too. So the good news is the most common side effects that have been reported in kids age 5 to 11 are the same as with any other vaccine. So a little pain at the injection site, it might get a little red, there might be a little swelling. Occasionally we'll see the headache, fatigue that are pretty mild in kids as it goes. And these side effects are temporary and go away within a few days. So this is just another way to look at those side effects. The green bars are mild, the blue is moderate, the gray would be severe, and it looks at redness, swelling, and pain at the injection site, both after the first and second dose, and it compares it to those placebo groups. So you can see that placebo, so the people that just got saline, still had some of the side effects. So the vaccine itself doesn't make it that much higher. And then the other thing you can see here is they looked at the difference between that 10 dose or the 30 dose. And you can see at 30, some of the side effects were higher, which is another reason that we're happy that we can use just the 10 dose. So the systemic events, meaning like the fatigue, fever, headache, chills, vomiting, joint pain, muscle pain, some of you may have experienced this with your own adult dose, but as you can see, the smaller dose, the 10 micrograms, is again better tolerated than the larger 30 microgram dose. And again, you can compare the top, which is the vaccine, to placebo, the saline at the bottom, and you can see that fatigue and headache are actually pretty significant even in the saline group. So you may have been hearing a lot about this vaccine-associated myocarditis, and especially in the older teens, those 16 and 17-year-old boys, is where the signal of, a concern for this was raised. So far in those safety studies for the 5 to 11-year-olds, there was 3,000 kids studied, and there were no cases of myocarditis during that safety trial. We do know that there was an increased risk of myocarditis in those males, like I said, particularly after the second dose. But even then, it was extremely rare. So when you look at the 16 to 17-year-olds who are most likely to have it, after the second shot, it was 1 in 10,000 people that might experience myocarditis. So that's 0.01%. So really, really tiny risk. And then we want to know, okay, well, can you get myocarditis from COVID? And absolutely. And when a child gets myocarditis from COVID, not only are they more likely to get it from the actual infection than the vaccine, but the vaccine associated myocarditis is much more mild than one that's caused by the actual COVID infection. So when you're thinking about, okay, is this a risk that we're willing to take? The benefit is that the vaccine is actually more likely to prevent myocarditis than it is to cause it, because it's preventing the child from getting COVID. So a lot of questions come up too about, well, but we've only seen, people getting it for this long. What happens about late onset side effects? You might have heard some concerns about fertility. And again, the good news is we know a lot about vaccines. And when we've been studying vaccines, no new vaccine side effects have ever been documented after 8 weeks post-vaccination. So 8 weeks, that's just 2 months. And when we're looking at these mRNA vaccines, it's even less likely for anything to happen long term, because the mRNA itself actually gets broken down within days by our body. So we feel really comfortable that we're not expecting any late onset side effects. So when you're looking at risk benefits, again, when you're thinking about, okay, what does this vaccine do? How is it helpful? So for every million doses of Pfizer vaccine in the 5 to 11-year-olds, is broken down into females and males, but we're looking at over 50,000 cases prevented. So think about, not only you didn't get sick, but you didn't miss school, you didn't have to contact trace with your friends, you were able to engage in the activities that keep your mental health good. So your sports, your theater groups, all of that. So that 50,000 cases that are prevented actually means a whole lot more to those kids. It also prevents around 200 hospitalizations, 130 cases of the MIS-C we talked about, and 60 to 70 ICU admissions, depending on male or female. So really great benefits from every million doses that are given. So I mentioned this briefly. So the FDA, when they were deciding on the EAU, did that same risk benefit analysis that we were just talking about, and they agreed that the benefits strongly outweighed the risks for children in 5 to 11 years of age. And that's why they voted to approve that emergency use authorization. So another question we hear a lot is, why is the vaccine dose based on age and not weight? A lot of parents are very aware that when we're giving medication to their children, we want to know how much do they weigh, because we're basing how much we're giving them of the antibiotic or of the Tylenol or ibuprofen on their weight. But vaccines aren't a medication. So remember, we're stimulating the immune system and getting it to attack a virus. And our immune system actually matures. So when we're younger, it's much more reactive, it responds to things faster, it makes a bigger response. So it needs less prompting to respond. So the vaccine's actually based on the maturity of the immune system and not weight. So even if you have a big 11-year-old, you don't need to worry about the adult dose or waiting until they turn 12 so they get a bigger dose. Their immune system should respond quite well to that smaller dose, and they'll probably thank you because they'll have less side effects. What about getting other vaccines around the same time? Well, unfortunately, with COVID, we've seen a lot of kids not getting their regular vaccines, whether they just not coming into the doctors to try and avoid exposure, or families are just too busy with, quarantining and contact tracing and trying to, just live life. So this is actually a great opportunity to get any of those vaccines that you're missing, because it's completely safe to give the COVID vaccine and any of the other vaccines, including your flu shot. And we know last year flu seemed great. It was, nobody really saw any. It was really mild. And as hopeful as we were that that was going to happen this year, the information we're getting from other areas is that the flu is going to be rough this year. It's an H3N3 that's the predominant strain, and that tends to affect children and older adults more significantly. So definitely encouraging everyone to get their flu shot and get caught up on any of those vaccines that they might have missed. So what happens if you get your COVID vaccine at a clinic and you want to go to your PCP to get a flu shot? It's totally fine. You don't have to separate it by a certain amount of time. If you do it on the same day or in a couple of days, a week, it doesn't matter. It's completely safe to get those vaccines back to back. So other things to remember when we're talking about the vaccines, it takes about 2 weeks after getting the second dose of the mRNA vaccine, so the Pfizer vaccine, for your body to build up an immunity to the virus. So just because your kiddo has one shot in, it does not mean they can, drop all the other protective measures. They still need to get the second vaccine and then wait 2 weeks to be considered fully protected. So, keep doing all the good things you're doing, wearing masks, washing hands, limiting contact. The other piece to remember is the COVID vaccine's free. So whether or not you have health insurance, it's covered. You don't have to worry about it. So if for some reason you're getting a bill from somewhere, definitely give them a call because it was probably an oversight. You should not be being billed for anything, and this should definitely not be a barrier for you. When are the under age 5 vaccines going to come out? So they're still doing the clinical trials, again, making sure everything's safe and effective. And they're looking at as young as 6 months old. So just like we do for the flu, 6 months and up. Again, they're testing smaller doses because the littler kids' immune system is much more reactive. So hopefully they can get away with a smaller dose and not have as significant side effects if they had to use the bigger dose. So stay tuned. Hopefully it's coming soon. Other resources for you, if you haven't registered yet for one of the COVID vaccine sites, the healthvermont.gov/myvaccine, you can register there. There's community vaccination sites, there's school located clinics, some of the pharmacies will have pediatric vaccines. And the exciting piece is our pediatric and family medicine clinics. So your primary care doctor, your medical home has started to receive vaccines this week. So we can start hopefully vaccinating kids in our own clinics. Currently, the supply is pretty limited. Vermont's getting weekly shipments, and they don't know how many of the vaccines they're going to get until it's there. So if you're running into trouble accessing, definitely stay tuned. Hopefully that supply chain will get better and we can get everybody vaccinated as soon as possible. Again, to find a site, if you go to that healthvermont.gov myvaccine, if you're already signed up there, you can add your children as dependents. So you can schedule your appointment there. And if you're having problems with the website, don't hesitate to call that phone number at the bottom of the slide. And you can use one for a language other than English. And you can provide consent over the phone for the immunization. More resources, the Vermont Department of Health has a page on COVID vaccines for children, healthychildren.org, which is a great place for any topic. From the American Academy of Pediatrics also has information about the COVID vaccine. It has a checklist of things to think about before you go in. And it also has a great page on the science, both for parents. And I believe that I saw a child site as well. And then the Center for Disease Control also has fun information on how the COVID-19 vaccines work. I believe they made a YouTube video that's very child friendly, which is fun to learn about the science. This is that Vaccines for Children page from the Vermont Department of Health. Their hashtag is Little Arms, so feel free to use that as your kids get vaccinated. And some of our current children 5 to 11 heroes who have gotten their vaccine. And I don't have a picture of my niece and nephew, but my favorite part was getting a video chat from them with their Band-Aids and how happy and excited they were to tell me that they had gotten their shots. Questions?
Thank you so much, Dr. Ashley. So we have a bunch of really great questions rolling in. I'm going to start with one that's a little bit more straightforward about underlying risks in kids and COVID-19 infection, how we think about that. So the question is, do we know if the children who are being hospitalized with COVID are kids that have underlying health conditions, or are they previously healthy? I think, the national data certainly shows that about a third of the children have no underlying health conditions at all, who are hospitalized. 2/3 may have something, but oftentimes they're really common conditions like asthma, which a lot of people have, or obesity, which a lot of people have. But I think this is a question that a lot of parents are asking because they're thinking about making the decision for their own child. And if their own child has no underlying health conditions, they're wondering what is the risk and benefit to my own child here? Say my own child is healthy. Is this still beneficial to them? So how would you talk to your families who have healthy children?
Sure. So unfortunately, it's like the flu. Some healthy children get really sick, and we don't know how to pick which of those healthy children is going to be the one that gets the most sick if they get the virus, whether it's COVID or the flu. So, yes, your child may be super healthy and hopefully they wouldn't get really sick, but to take that risk of them getting, having to be hospitalized, having to be intubated, when we know it's preventable from a vaccine that's really effective and safe, I'm strongly encouraging all of my families, even if they feel like they're super healthy, to get their kids vaccinated. And then the other piece to think about is the other people in your family. So elderly adults, immunocompromised adults who might not be able to be fully protected by the vaccine. You want your kids to be able to spend time with them, and having them vaccinated will create that safety net around the other family members who might not be as protected. So definitely encouraging everybody to get the vaccine.
Another really good question. It came in a little bit earlier before you actually got to this slide, but I think it's worth readdressing. Is again this question about long-term or late
Mhm.
onset side effects, and this is on the one hand, this is a new vaccine. On the other hand, millions and millions of children and adolescents have received it. But again, how should parents think through this decision and what do we know and what do we don't know about again you did talk about this a little, but if you could expand a little bit more on late onset or long-term side effects and this vaccine and vaccines in general.
Yeah, so it's a great question, and never can say too much. And actually, it was one of the things I've learned in learning more about vaccines. And I didn't realize that with all the vaccines that have already been developed and we're already giving children, that the likelihood of any effects after 8 weeks is almost zero. Like, that's amazing to me, because you would think that maybe something would happen, but we have a lot of evidence and a lot of experience that show really we're going to see anything in 8 weeks. And then this vaccine in particular is interesting because it's a protein, so an mRNA, and it gets injected into the body, but then the body breaks it right down. And not only does it break it down quickly, it breaks it down locally. So it doesn't even affect the rest of our body. It's just presented to our immune system. So another reason that we don't expect to see any long-term or late side effects, which is really good news.
And what about fertility? You said that you had mentioned that similarly that people are hearing a lot about that, and it's something especially we heard a lot about when we did these forums for the 12 to 15 year olds. We're hearing a little less about that now, but how do we reassure families about effects on fertility?
Sure. So the vaccine I like to compare it to, where we heard a lot of concerns about effects on fertility, was the HPV vaccine. And I think we heard about that because people saw it as a reproductive vaccine, because it was related to cervical cancer. And Australia actually mandates the vaccine and has been vaccinating since the late 1990s, early 2000s. So we have a lot of great data from there, since everyone's required to have it, about safety and effects on fertility. And they found no effects on fertility at all, which again, reassuring. And we can expect the same from the COVID vaccines, especially where we talked about how it's broken down locally in the body. We don't expect any effects that would affect our fertility in any way, shape, or form. One of the other interesting things I heard when people were, trying to figure out where this might have come from, whether people were seeing changes in their menstrual cycles. And it was interesting to hear the theories behind it, and thinking about if our body's creating a big immune response at that time, or if you got sick with the flu, your menstrual period might be off by a couple of days, and that would be totally normal and acceptable because your body wouldn't want to have a baby right then. So I think some of the things that have made people worry about fertility actually have really understandable causes that are not fertility affected at all.
Okay, another common question we have here is about boosters. And I know you don't have a crystal ball, but we do have a lot of, most of our, or all of our childhood vaccines require more than one dose, right? So it's not surprising that this vaccine requires more than one dose. And do you have any thoughts about um, what you might predict for boosters heading
Sure.
forward and why it might be the case that some people need boosters?
Sure. So, what we're seeing now in the adult population, and again, this is being such a well studied vaccine, we're looking at waning antibodies, which we know doesn't directly tell us how immune we are or how protected we are from COVID, but we're using it as a marker. And that's one of the reasons that adults have been recommended in certain populations to be boosted. But as Becca was saying, in all of our kid vaccines, we usually have at least two, if not more. So, like our vaccines at 2, 4, and 6 months for our infants are all the same. And then some of them are again boosted at 15 months and at 4 years. So, it's not unusual to need a series of shots to get the immunity fully ready to go. And when we're doing the 2-shot series, so 1 and then 21 days later, we know that we get a robust response, but what we're seeing is whether or not that is going to wane. I would not be surprised if children were also recommended to boost, especially in certain populations in 6 months. But again, that's not a bad thing. That's actually a really good thing. So we can help prolong our protection. People have asked me, well, what about the flu vaccine? It changes, they have different strands. Are we going to need to get vaccinated each year? We just don't know yet. We've been really lucky that the vaccines have protected against the different variants that have arisen. So that's promising that maybe we won't have to have separate vaccines each year. But we may end up vaccinating again to boost that immunity, like we were talking about.
Thank you.
Mhm.
And you touched upon this, but we have two questions related to dosing and age and size. So if we could just review that again. So one question is, I have a child who's 11, who's turning 12 next month. Should I wait and get the bigger dose to have a bigger effect? And likewise, another question about a very small, um, actually premature 5-year-old who's small for their age. Is this vaccine okay and safe for them?
Great questions. So for the 11 turning 12, and not only has, the CDC, FDA given us guidance on this, but we're lucky enough to have two great infectious disease doctors that help us think through these things in Vermont. And because it's based on how our immune system is going to react, the recommendation is to get the dose for the age you are. So if your child's 11, go ahead and get that vaccine now. There's no benefit from waiting until they turn 12 because their immune system is primed enough to respond to the 11-year-old dose. And that being said, if they turn 12 before they get the second dose, the recommendation is again to get the dose for the age they're at. But I would hate to wait the 3 or 4 weeks for them to turn 12 and risk getting COVID during that time. So definitely go ahead and get the vaccine as soon as you can. You don't have to wait for your 11-year-old to turn 12. As far as the prematurity goes, if you have a lot of complications from prematurity, I would definitely talk with your specialists about the best time to do things and whether there's anything specific for your child. But just prematurity and being small in general does not make us think that there would be any problems. So if your child's been getting their regular immunizations throughout their life, they would be totally fine to go ahead. The vaccine is safe even if you're tiny.
On that note, what about size aside, what about underlying conditions? So there's a parent who's saying that their child has asthma and that child will be turning 5 soon. And so they're thinking about the vaccine. What would you recommend for a child who has asthma?
Yeah, absolutely. So I worry really a lot about my asthmatics during all of this. I've seen in adults some pretty significant prolonged illness from COVID, given their underlying asthma. And these are people who are very well controlled in their asthma. You wouldn't even know that they had it. Um, Luckily, because we're in Vermont and the rates have been low until recently, I haven't seen it a lot in my own patients, but it is something I talk about with all of my asthmatics, their family. We talk about controlling their asthma as much as we can and getting the vaccine as soon as possible and making sure everyone around them is vaccinated. And we have similar conversations with the flu vaccine every year. Everybody should get vaccinated to help protect those asthmatics. But I feel like this COVID vaccine is even more important because we definitely have seen the effects that COVID has on the lungs directly.
Yes, and I would second that as an ICU doc that I definitely worry about the kids with asthma and other breathing issues, and they should for sure um, be vaccinated. And the other, no one's asked us yet tonight, but we've had this question come up is children with heart conditions, and it's the
Mm.
same thing. The pediatric cardiologists say absolutely, we worry much more about the infection. Um, Another question we have here is, so unfortunately, Vermont is seeing a lot of COVID these days, especially among children, as you pointed out. So what about a child that has COVID right now? What do
Mhm.
you recommend in terms of when they get back? The timing, should they get vaccinated? The timing around getting vaccinated? What would you recommend?
Yeah, so it's a great question. So we have to worry about exposure of other people, obviously. So in that first 10 to 14 days when they're symptomatic, we recommend you continue to isolate at home. But then when the symptoms have resolved and you're out of isolation, definitely going ahead and getting that COVID vaccine to continue to help protection.
What about if you could talk a little bit more about you've talked about mRNA and the disintegration. And again, is this something that can be considered like a genetic modifier as a vaccine? Does it change your genetics at all? Is that something that people should worry about?
Sure. That's another great question and a common concern because a lot of us remember from science class that mRNA has something to do with like the DNA and the nucleus of the cell and reproduction. Um, but again, the cool part is the mRNA doesn't have to enter our cells. It doesn't have to become part of our DNA to create the immune response. And because it's mRNA is a type of protein and our body's really good at breaking down proteins, it really just stays in that local area of the shot site. It creates that immune response that we need, and then it's broken down very quickly. So we don't have to worry about it genetically modifying anything. It's just not created to do that. It can't do that.
Dr. Ashley, could you talk a little bit more about, you talked a bit about what we know about hospitalizations with the COVID-19 infection. Um, and there's a question here about what some people call natural immunity or infection induced immunity. And the question is really, you know, if my child gets COVID-19 infection and then has some immunity from that, is that better than vaccine induced immunity? How do we think about that? And then how do we think about what we know about the virus and what that could do to children beyond maybe hospitalizations?
Sure. So, you know, all of us love anything that says natural. So natural immunity sounds like it must be the best thing. It must be wonderful. It's natural. But COVID is sneaky in so many ways. And one of the sneaky ways is people who have the COVID virus all respond differently. Some have a great immune response and do have protection afterwards, and some have very little response and very little protection afterwards. And there's really no good way for us to tell. We also don't know how long that natural immunity would last and if it was strong enough to protect against the different variants. So the recommendation is still safer to get the vaccine. You definitely don't want to risk having one of the severe complications of COVID just to get a natural immunity. And that natural immunity is actually not stronger or better than the vaccine mediated immunity. So I would still say protect yourself, don't get COVID, get the vaccine. And if you've already had COVID, the vaccine can offer you further protection. So I would still recommend going to get your vaccine.
Another question is, how how good are these vaccines? We have people. We live in a highly vaccinated state, at least in comparison to other states in the country, and we have a bunch of cases now. We have people who are vaccinated. We all know people who have been vaccinated who have been infected. Um, Currently, the recommendation is that everyone wears a mask indoors, including people who are vaccinated. So, what is the real benefit of getting vaccinated? And are we even sure that the vaccines are really helpful?
Sure. So I don't think a lot of us really think about how effective the vaccines that we get are. Um, and I was actually surprised that some year the flu vaccine is only like 50 or 60% effective. Because again, we have to pick which strain we're thinking we're going to protect against. The COVID vaccine is great because we don't have to predict which strain we're using. It's been really effective against the variants as well. And it's actually 90+% effective. So that's incredible. But when you have millions of people being exposed to COVID every day and not all of them vaccinated, um, they're going to keep spreading it. So for each person that gets infected, they can pass it on to 8 or 9, 10 different people. So if you're having that, those numbers are so big, we're expecting that you would see, that 10% of the population that can still get that can still be vaccinated and get the virus. So the good thing is that we are seeing that those that are vaccinated are less likely to be hospitalized. And if they are hospitalized, they're less likely to end up in the ICU and less likely for COVID to be fatal for them. So because the numbers of people exposed and getting COVID are so big, you will see people who are vaccinated that will get COVID. But again, the good news is the severity is still lower if you're vaccinated. Oh, and your question about masks. So eventually, hopefully, we can have enough people vaccinated. And it's unfortunately not just our state. Like Vermont's doing a great job. I showed you some of those numbers, but we live in a really mobile community, right? So like people will go to New York to see family members this Thanksgiving. Some will go to the Midwest. So as long as COVID is spreading in other parts of our country, we still need to be careful. And hopefully someday we're going to get to a high enough vaccine rate in Vermont that our kids won't have to be masked in schools, that we'll be able to gather if we're all vaccinated. But right now, because COVID is still spreading so widely, we need to use those extra layers to protect us as much as possible. And remember, kids are just getting vaccinated now. So our 5 to 11-year-olds are just getting the first dose. So really we need to get 80% or more vaccinated with both doses and be 2 weeks out of the second dose. So it's going to take a little bit. So, buy your favorite holiday mask and plan on wearing it and being festive. And it unfortunately is going to be part of our lives for a little bit longer. But hopefully with vaccines and these measures, COVID will become more and more like the flu and we won't have to worry quite as much.
What do you recommend for kids who are signed up to get their vaccine at a community site, so not at their regular doctor's office, in terms of um, preparing the child
Mhm.
to get vaccinated?
It's a great question. So a lot depends on how your child does with vaccines in general. Like if they already have shot anxiety, but thinking about the things that can help them and has helped them in places where they've been anxious before. So some kids like to wear their headphones. Some kids like to watch their iPad. Some kids are kids that need to know exactly what every step is going to be before they get their shot. Other kids don't want to know. They don't want to look. Just distract me, just do it, get me out of here. So knowing what works for your child in the past is super helpful in preparing them for one of the other offsites. There are some videos on some of those websites that I mentioned that actually talk you through, like, what is this going to look like? You're going to go into this place, you're going to see these people, and all those steps. So that can be really helpful. Um, and if you're really worried, if your child is a child who has extreme shot anxiety, the one that we're pulling out from under the exam table or under the chair, and, it takes 15, 20 minutes to get them ready for a shot, maybe the community clinics aren't the best place, and definitely talk to your pediatrician about that. They'll know for sure. But we have things in our office that we find helpful. So like some of those squeezy balls, some I spy activities so they can be looking for things while they're trying, or while you're getting their shot done. Um, I don't know, I call them rainmakers, but they're the tubes that you turn upside down and it moves things through and they can watch them. So there's lots of different things that you can access or bring with you to help distract them and help make the whole thing more pleasant. But definitely, if you're worried, reach out to your pediatrician for ideas. So we want to make it as friendly and exciting as possible because they're all happy to get their shots too and protect everyone.
That was actually the next question, was a child with sensory issues and what you would recommend. And it sounds like make a plan with your child's medical provider is really the right thing. And what about would you recommend doing anything different with the time interval with the first and second dose? So would you ever recommend delaying the second dose, like getting the first dose? Different some folks have asked about if they've had COVID, do they only need one dose?
Mhm.
Or should they space out their 2 doses?
Sure. So the studies were done with the 21 days. So what we know about how the vaccine works, how effective it is, how long the immunity will last is really based on that 21 days. So I encourage people to stick to that as closely as they can. Now, obviously, if you drove to Keene to get your first shot and you can get your second shot in the town over, and it's going to be 4 days later, no big deal. That's totally fine. But I would not purposefully, create more time between those two shots. And definitely, even with having the COVID virus, I would go ahead and get your two vaccines because, again, we know that's going to establish your immunity, and we're not sure what would happen with just one.
Thank you so much. So, Dr. Ashley, you've answered all of the questions in the chat box. I'm
Great.
wondering if you could just leave us with a few thoughts and words about, again, why you recommend this for your patients, for your loved ones. It sounds like your niece and nephew maybe got vaccinated recently, and how you talk about this with your family and your friends, and why you think this is important.
Yeah. So this has been something that I've been waiting for since all of this started. So COVID has been devastating to so many people around the country. And we've been lucky in Vermont. We haven't seen a lot of it, but with my other physician networks, listening to people on the front line, ER docs, pediatric intensive care docs, it's been really, really hard on everyone. And the vaccine is the way out of this. So I have been following it really closely and watching the studies and watching the information and feel really comfortable that this is the right answer. This is going to keep our kids safe. It's worth a sore arm and maybe feeling under the weather for 48 hours. And I have been amazed by how much the kids get it. Like they get it. I have kids ask me, when can I get my germ shot? I want my germ shot. Can I have my germ shot now? Um, like I said, my niece and nephew wanted to video chat and show me their band-aids because they were so proud that they got their shots. So, you know, if you have any concerns, please don't hesitate to reach out to your medical home so you can talk through them, especially if there's specific questions about your own child. But I'm very comfortable and I can't wait to offer the vaccine in my office.
Thank you so much, Dr. Ashley, for your time. And thank you for all of those who joined us again at a really challenging time of night. It has been recorded, and so this will be available on our website, which is aapvt.org. And you're welcome to look for it in the next day or two and share it widely, please, with friends and family. And you can also contact us through our website as well. So thank you all and have a great night. Bye.
Thank you.